in all forms is the reason there is a great deal of misinformation in the United States and in the entire world. Media can be the root of all chaos. Research suggests that educating the public about the Ebola virus is the key to understanding of how to prevent the spread of the virus and preventing chaos from occurring. Some key facts that the public needs to be aware of for the understanding of the Ebola virus disease, according to the World Health Organization. First, the virus is transmitted to humans from wild animals and spreads in the human populations through human-to-human transmission. Next, Ebola virus disease is also known as the Ebola hemorrhagic fever. It is often a fatal illness in humans. Case fatality rates have varied from 25 to 90% in post-outbreaks, according to the Center for Disease Control. However, the key to successfully controlling outbreaks is community engagement and early supportive care with rehydration. Symptomatic treatment improves survival, according to the World Health Organization. The next main point that I would like to bring is protecting oneself from Ebola. There are several ways, according to the Centers for Disease. For instance, you need to wash your hands with soap and water or use an alcohol-based sanitizer. Do not touch blood or body fluids like vomit, sweat, feces, urine, saliva, and semen of people who are sick. Do not touch the body of someone who has died of Ebola. Do not handle any items that may have come in contact with a sick person's blood or body fluids, like bedding, clothes, medical equipment or medical supplies, needles. Also, do not touch bats and non-human primates or their blood and fluids. Do not touch or eat raw meat prepared from these animals. Finally, avoid traveling to countries where Ebola is prevalent. The last main point to educate the community about is treatment, vaccines, prevention, and control of the Ebola virus disease. Treatment of specific symptoms and supportive care such as rehydration with oral or intravenous fluids improves survival. There is no proven treatment available for Ebola virus disease. However, a range of treatments, including drug therapies, immune therapies, and blood products, are currently being evaluated. There are no licensed vaccines available yet, but 2 potential vaccines are undergoing human safety testing. Good outbreak control relies on a package of interventions, such as case management, surveillance, contact tracing, good lab service, safe burials, social mobilization. According to the World Health Organization, community engagement is key to successfully controlling the outbreaks. Also, educating the public of risk factors, prevention and spread of the disease. Reducing the risk of wildlife to human transmission of fruit bats or primates for food should be thoroughly cooked before consumption. Reducing the risk of human-to-human transmission from direct to or close contact with people that have Ebola symptoms. Also wearing the proper protective equipment when caring for Ebola patients. Finally, outbreak containment measures including prompt and safe burials of the dead, monitoring the health of contacts for 21 days, the importance of separating the healthy from the sick to prevent further spread. In conclusion, educating the public about the Ebola virus is the key to understanding of how to prevent the spread of the virus and preventing chaos from occurring. Educate, educate, educate. That is the key. Are there any questions?
Yes, I have a question. How is the Ebola virus introduced into human population?
According to the World Health Organization, it is introduced through close contact with secretions, blood, organs, or other bodily fluids of infected animals, such as chimpanzees, monkeys, gorillas, fruit bats, porcupines, and forest antelope, found ill or dead in the rainforest. Then it is transmitted from human to human via direct contact through broken skin or mucous membranes with the blood, secretion, organs, or other body fluids of infected people, and also with surface materials, including bedding and clothing, that has been contaminated with these fluids. Did anybody else have any other questions?
So what is the best way to prevent chaos with the public over this whole Ebola virus?
That's easy to understand. According to the National League for Nursing Center and the Center for Disease Control and the World Health Organization, education is the key. If people understand the how, the why, the where, and what of the virus, they will feel more safe and secure. But you need to go to the correct websites, such as cdc.gov or WHO International or NLN.org. When the public sees or reads it on the social media sites, the stories grow larger and larger, and before you know it, it's a whole state that's infected with the virus, and then we have chaos. Then they find out that the story's false. So get the facts first before you panic. Educate.